Hi everyone, I'm Dr. Katrina Mattingly and I'm going to talk about FDA-approved appetite suppressants, specifically phentermine, phendimetrazine, and diethylpropion. Now these are what we call sympathomimetic amines, which means that they mimic chemicals found in the sympathetic nervous system. Norepinephrine gets released from the hypothalamus in your pituitary gland, right here in your brain, and that travels to the gut to stimulate your gut to shut down any feelings of hunger. If you remember, the sympathetic nervous system is responsible for the fight or flight response. And that's the response and the feeling and the nerves you get in your system when you're in danger or there's some kind of psychological, emotional, or any kind of perceived threat. So that's how we use these specific chemicals to control appetite on people that want to lose weight. Now, people who are good candidates for any of the appetite suppressants are people who have a BMI greater than 30 or greater than 27 plus one comorbidity. That's what it's FDA approved for. We can go down to a BMI of 25 if you've also got an elevated waist circumference or body fat percentage. So we can give it to those patients as well. And then people with comorbidities, we're talking high blood pressure, anybody who's just obese, overweight, anybody who's pre-diabetic or diabetic, sleep apnea. That's another one. A lot of people don't realize that sleep apnea is actually a comorbidity and it contributes a lot to obesity. So these are different people who are great candidates for these drugs. Now with phentermine, we can use it in combination with some other drugs and start at a very low dose, starting anywhere from 3 to 4 milligrams, going all the way up to 37.5 milligrams. Usually it's taken in the morning before breakfast, and then you'll get your appetite controlled throughout the day. Sometimes you might need a little bit of a booster in the evening, so we'll either have you split your dose in half or we'll add on a different drug that's a booster. We've also got our phendimetrazine. 105 milligrams extended release is the easiest for most patients to take, and you get pretty good appetite control into the evening with that. It doesn't interfere with sleep as much as the phentermine does, according to most of our patients. And it's also good for people who may have some drug interactions with other antidepressants or serotonin type drugs that they're already taking. Then we have diethylpropion. We have 25 milligrams that you can take 3 or 4 times a day if you need a booster. So that one's good because it's a little bit shorter appetite control, so we could just use one dose sometimes if someone just needs a booster. There's also a longer acting one, which is 75 milligrams, but for most people, they're 25, they just like to take 25 at a time and see how they do. So one of the things that's really important to look out for with these particular drugs is something called serotonin syndrome, which is for people who are taking SSRIs or SNRIs, which are serotonin, selective serotonin reuptake inhibitors, or selective serotonin norepinephrine reuptake inhibitors. So some symptoms and signs of that are that you're feeling a little anxious. You may feel your heart's racing or your mouth is dry, or you may feel a little confused, jerky or tremulous. And sometimes these can also be regular side effects of taking the appetite suppressants. So we ask you to drink some water, do some breathing, some meditation exercises at home. And then if the symptoms persist, we have you give us a call so that we can figure out if further action needs to be taken. All right, so the philosophy is that you can take these drugs alone, or you can take them with a diet system. Options diet system at Options Medical Weight Loss is what we advocate for. It works really well when you do that, and you also do some behavioral modification, which is just increasing in your exercise. All right, so thank you so much for watching. I hope this helps shed a little bit of light on what the different appetite suppressants are. And if you'd like a free consultation, please don't hesitate to give your local Options Medical Weight Loss a call. Thanks so much for watching. Bye-bye.